this up with you before. I talked about making the decision to deal with our trauma, say coming to a therapist, psychologist, and so on, but also not wanting to live there.
Yeah, yeah, that's a very important point, because that's what you want the patient, the client, to be, is free. You want to give them freedom of choosing on their own. They're not free. People, when they come to therapy, is because they're attached to so many things that are torturing them, that don't allow them to make their own choices. And perhaps a little bit is, maybe I want to explain a little bit my approach to, self-hate and what it means, where it's coming from my perspective. It's a Freudian approach, a classical Freudian approach. And psychoanalysis also has different schools of thoughts, so depending on who you follow. But from a traditional Freudian perspective, the mind is divided. It's divided in, or he divided the mind in it, which is the instincts, that instinctual part of that wants us things. It could be anything, it could be even wanting food, wanting sex. And he divides those instincts in two perspectives, two roots. And one is he called it the eros from erotic, that part of our selves that wants life. That's what it is, an instinct to life. And then the other part, which he called it thanatos, or death. And then thanatos, I think I'm pronouncing that right, thanatos, which is a god of death in Greek mythology. And so you have that instinct, which is the id, and then and it's run under the pleasure principle. So a baby, for example, is 100% id, 100% instinct. That the only thing they're thinking is, give me food. I want food. They're not thinking, why is it? Is it what kind of food? What they just want food, and you have sort of demanding to satisfy that pleasure principle. Then you have the ego, which is not the same ego as the popular belief. Ego as we're too egocentric, or it's a different kind of ego. Ego is also called the I. It's the me. It's the organized, realistic part of our psychic. It's the one that is more realistic. It's the one that is in contact with the outside world and has to make decisions, and goes through the reality principle. That's what he called it, the reality principle. It's the one that most therapists focus more on the ego, the reality, or the one that makes decisions. And then we have the other part, which is the superego, or above I, which is well described because it's something that has to do with the critical or moralizing function of our psychic. It's it incorporates the values and the morals of society that we learn from our parents, our caregivers. Yeah. They incorporate those moral values, and that is the superego, is the one that tortures people when those demands are too high. They bring guilt. And he actually divided the superego in a part of the ourselves that is the moral side, and the ideal self. So the ideal self is the image that we have of ourselves that we want. And sometimes it goes above of what we perceive ourselves to be. So we're saying we should be more than who we are. We should achieve these. And that's when it's never, you have this
never ending,
ideal, never enough, because you have this ideal image, which is a lot of times even perfection. And it's unachievable. That's why it's never enough, because you want to be this image that you have of yourself, this ideal self, That's unreachable.
Because we're not satisfied with what we have, and we keep. I mean, society itself tells us more and more, and
Well, yeah, because it's
look like this, be like that.
well, it's you have to think that we internalize at some point the first years. Actually, the superego comes into place when around age 4 or 5. In the beginning, nobody is. Babies are not thinking it's wrong to do this. I shouldn't be doing. Little children. That's why they do things that with no issues, no problem. It's the parents that put those limits.
Have you had to deal with the effects of social media on your patients? Like, I'm trying to parallel that with what you were just talking about of the pressures of having to be like this, having to be like that. It's not enough. And we already had that, I'm sure, in the 70s, 80s, and 90s,
Right.
2000s. And then social media comes along.
Right.
And now it's hitting these kids really early.
Yeah.
And now they're not just comparing themselves to the kid at school. Now it's thousands of kids.
Right. I think that what happens is issues that humans have always had to go through, mental health issues, are being expressed differently depending on the culture and the historical moment. So in the 1500s, people would be being accused of being witches.
And they would burn them.
And they would burn them.
What was it? How did it work? If the woman didn't fly?
Yeah, I don't know. Whatever it was, but you would see mass hysteria.
Yeah.
So people who would say, I'm being possessed by a witch. And everybody would, especially you would see it in teenagers and especially in girls, that they would just be thinking that I'm being possessed by something, and they would show the symptoms. And so they were using their issues, but adapted to the culture of that time. Then in the, in Victorian era, when, sex was so repressed and women were allowed to do so many things and only men could do them. Not that it has changed that much, but at least it's a little better now. And so that's how Freud came into the picture, because he would see all these women with all these issues. They were having psychosomatic symptoms, paralysis that were coming from, it wasn't, they could not find anything that was physical. And most doctors would make fun of that. They would not take it serious. But Freud was one of the first that was interested in that and saying, well, wait a minute, there's something, they're not making this up. They really are having a paralysis, only they believe it. They're putting into their body what they can't be, what is being repressed. Usually it was sexually repressed because they weren't allowed to have a sexuality in those days. And so he was seeing all these patients, and that was an expression of those times. We don't see that kind of patients anymore because we don't have that, maybe at least not in this part of the world, we don't have that repression. But we have other issues like you're mentioning, social media.
There's a